Good afternoon. This is Chairwoman Florence Jameson. I'm calling the meeting to order. Can you hear me?
We can, Madam Chair.
Welcome. And Mr. Gilbert, would you do roll call, please? Or should we come back to that? Or just go ahead and do roll call. When Lavon comes in, we'll notify you.
Thank you, Madam Chair. Dr. Jameson.
Here.
Dr. Grinstein. Ms. Lewis. Ms. Wilson. Ms. Clark.
Present.
And Mr. Melendrez.
Present.
Ms. Aiello.
Present. Present.
Mr. King.
Present.
And Ms. Nielsen.
Here.
Thank you.
It's better than some ringtones I've heard. It's all good.
As far as announcements, I'll just note as we go into public comment that as far as I was aware, we just had the one written letter for any of those who wanted to see it. It's in the records. And is there anybody here who would like to make public comment in Southern Nevada? I don't see anyone down here, Bruce. And do you have anyone in Northern Nevada who would like to make a public comment?
I see none here, Madam Chair.
Going on then, since there's no public comment, and the next item on the agenda, approval of minutes, we'd like to have a quorum. Let us then just go ahead to the, do I hear Yvonne coming in? Yeah. You know, I hear Yvonne's heels in the hall, so why don't you just take a deep breath slowly, and then you can give us, we'll do the minutes as well as the executive director's report. I'm pretty sure that's her now. You want to check Yvonne's? Since we can't really do the minutes without our quorum, and because I'd like her to hear the executive report, but I actually think she is here. Yeah. All right. Maybe that wasn't her, so we'll wait on the minutes and go ahead with the executive report.
Thank you, Madam Chair, members of the board. Well, we are deep into another open enrollment period. It is our third, and these are busy times for the exchange and for staff. Early indications are that open enrollment is going very well.
Excuse me, Mr. Gilbert, just for
Yes.
the record.
Yes, ma'am.
Yvonne is present.
We will note that there is now a quorum present of the board at 1:45 this afternoon.
Please continue your report. I'm sorry about the interruption.
No, not a problem. Thank you. It gets better the more I do it, so it's all good. As I was saying, yeah, we're deep into open enrollment. The staff is very busy. It appears from early indications that everything is going well. As of December 5th, which is the latest that we have numbers for, over 31,000 Nevadans had enrolled in coverage through the exchange for 2016. That's really interesting because that number is more than 50% of the enrollment that was in force at September 30th. So that's a really good number. But even more importantly, some 11,000 of those enrollees, over a third, seem to be new customers, that is, individuals who had not purchased a health plan through the exchange last year. This is particularly good news because there's historically been a surge around December 15th, which is usually the deadline for January coverage, and which was, of course, extended a day or so ago to December 17th. We've spoken with our participating carriers, with a number of agents and brokers, and everyone agrees that enrollment has been brisk. Our expectations are that we will see enrollee growth this year, certainly not on the level of last year's doubling, but still a very healthy increase in enrollment. Of course, not everything has gone smoothly. The healthcare.gov website has seen some outages and appears to be struggling to handle the demands which are being placed upon it nationwide. They've had to set up waiting rooms and extend the deadline for January 1st inception dates as people attempt to purchase coverage. So what I would tell you is the performance of the technology has certainly fallen off from last year, and that's frankly troubling in light of the recent CMS proposal that state-based marketplaces on the federal platform should pay an access fee equal to 3% of the premiums generated by plans sold on the exchange. It seems clear that if we were to pay 3% to CMS as requested, there will not be an opportunity to sufficiently fund meaningful exchange activities here in Nevada. Further, any additional assessment, which would be placed atop that to support our activities, would unfairly skew on exchange premiums to the detriment of Nevada's consumers. There is, however, a more important message here, I think, and that is that the proposed rule indicates that only 15% of the monies expended by the federally facilitated marketplace are used for marketing, consumer outreach, and education. And I'd ask that the board think about that for a minute. 15% to cover marketing, consumer outreach, and education. By comparison, our exchange spends over 60% of our budget on those activities. In fact, no state-based exchange spends only 15% of its budget on educating consumers and working to increase enrollments in underserved and vulnerable populations. And that is true because, as we learned just a couple of years ago, our business is not primarily technology. Our business is reducing the number of uninsured Nevadans. And while having access to robust, dependable technology is helpful, technology alone is not capable of getting the job done. I would suggest that it is particularly true after the low-hanging fruit, which is the more than 200,000 Nevadans who wanted insurance and signed up for the expanded Medicaid program or for qualified health plans as soon as they had the chance. That's gone. And we're looking at a more expensive and targeted outreach being necessary going forward. We are, of course, providing comments in response to the proposed rule, as are a number of our stakeholders. But I think that it is clear, given the proposed rule, that we cannot rely on CMS to provide a solution to what is now, by their own action, both a technology and sustainability challenge. I understand that CMS has to serve millions of people across more than 30 states, and I certainly give them credit for what they have done. But their worldview and our own here in Nevada at the exchange, when it comes to customers and to the importance of consumer education and outreach, and when it comes to the value that a state-based marketplace offers, are radically different. It seems unreasonable to simply pay CMS millions of dollars for a technology platform that stutters when it's pressed, that can't provide state-specific reporting, without doing all that we can to assure that Nevada's consumers are not harmed through unnecessary premium increases or shortchanged in any way. These are challenging times, certainly, but I am confident that we will ultimately find a way to continue to reduce the number of uninsured Nevadans that is cost-effective, that is affordable, and that is consistent with our unyielding commitment to our consumers and to the citizens of this state. That would be the sum and substance of my remarks, and I'm more than happy to take any questions.
Do we have any questions from the north? Are there any questions?
LaVon Lewis for the record, and I just had, I don't know that you would be able to answer this, but you mentioned that they were only going to spend 15% of the money on marketing and outreach, and I was just wondering, what are they spending the rest of the money on?
Thank you, Ms. Lewis. This is Bruce Gilbert for the record. Actually, in the proposed rule, what the CMS has said is that the 3% which they wish to assess state-based marketplaces that remain on the federal platform represents 85% of the 3.5% that is assessed to states that are fully on the federally facilitated marketplace. And in their commentary, they said that they have determined that technology costs essentially represent 85% of their expenses, and that's how they arrived at the 3%. So by all the skills that I learned in all my years of schooling, I subtracted 85 from 100, and I determined that 15% was all that they were spending on other activities.
Mr. Gilbert, I'm afraid you really spoiled me when you first came on and provided written reports. I would love to, if it's possible for you, and I know you have really been very busy prior to this meeting, especially anticipating and then finally receiving the federal government's 3% number that they put out there, and I know you've been working hard to look at alternatives. But if you do get a chance, I would really love to see those reports, as you did in the beginning, in writing. And I would just like to compliment you. That was an excellent report, and I appreciate you bringing up for all of us the concerns as we have been very busy with the federal hub, that they've actually had some technical issues, and there has been a little bit of delay. We all know sometimes all it takes for a consumer is a little bit of difficulty, not even moderate or a lot, to then drop off of the process and not follow through. So that is still always a very important thing on the technology side. And I don't know if we can actually ever get a feeling for how many people are experiencing right now. It was difficult enough in the past when we had Xerox. All we really could do was go by feedback from our brokers and our navigators as to the difficulty our customers were having and the brokers were having. So I'm not sure what the magnitude of that problem is, whether it's just little, medium, or small. Of course, we would hope that it would be less, is less than 1% or non-existent. But of course, we all know technology. There are always going to be some delays, some problems. Do you have any sense of the magnitude of that problem?
Thank you, Madam Chair. Bruce Gilbert for the record. And I apologize, frankly, for not providing a written report this month nor last. I have been busy, as you know. Nonetheless, that's probably, I don't want to make an excuse. And I will certainly attempt to make sure that on a going forward basis, that's not an issue. I don't believe that it's possible to determine the magnitude or the impact of the healthcare.gov issues on our state citizens. I don't know that they are tracking that information in any meaningful way. They certainly are not reporting it to us in any meaningful way. I would note that the situation was significant enough that they extended the open enrollment period for January 1st coverage to attach by 48 hours. So clearly it was not just a blip on the radar screen, but I'm not able to give you any specifics at this time.
That was still very helpful and very, very informative. Thank you very much for that report. I would like to now go back to item number 3 on the agenda, the approval of the minutes for November 12, 2015 board meeting. Could I hear a motion?
Levon Lewis for the record, and I move approval of the minutes of November 12th.
Is there a second?
Second.
Was there any discussion? Is everyone in favor? Everyone in favor say aye.
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 Anyone opposed? The minutes for November 12, 2015 are passed. Going to item number 5, discussion regarding the semi-annual fiscal and operational report to the governor and the legislature. I would like to say that was an excellent report as well. Bruce?
Yes, thank you, Madam Chair. Bruce Gilbert for the record. As you know, we do have a statutory obligation to provide the governor and the legislature with reports twice a year that provide information about our activities and also fiscal information as well, and ultimately recommendations with respect to the exchange. You'll notice that there is a draft letter for you, Madam Chair, which indicates that we are providing this information, and thereafter you will see that there is a roughly 8-page report which covers our activities to this point in time and since we last reported to the governor and the legislature. I think it's very straightforward. It talks about how we continue to transform and while focusing on our ultimate objective. It discusses the strategic initiatives, which we have covered in previous meetings. It sets out the voting membership and the ex officio members of the board, indicates where there have been changes in staff, and a significant portion of it deals particularly with our marketing, advertising, and outreach activities since our last report. And of course, with the inception of open enrollment, that would take the bulk of the report that we would be providing. We do touch upon navigators, enrollment assisters, and CACs, and Mr. France has provided information with regard to our budget, which is up to date. I believe that it is a full and fair description of our activities since we last reported to the governor and the legislature, and I would ask that the board approve it and permit us to file it on their behalf.
Are there any questions or comments on the report for Mr. Gilbert?
Lavon Lutz for the record. I thought it was an excellent compilation of what we've done over the last year.
I as well thought it was, and also a little excellent bit of journalism. I particularly, well, actually I liked all of it, but in the beginning, your differentiation between strategic initiatives and a strategic plan, I thought that was very good, and I liked the way, and it couldn't be more apropos when you see how flexible we have to be when the federal hub, just now gave us the 3%. I mean, these are things we have no control over, and would make it very hard to set a long-term strategic plan. So I like the strategic initiative that you start off with explaining it. There was, I'm trying to find it, you might be able to direct me to it. I think somewhere you had mentioned about 11,000. I thought it was in this report, but I don't see it. Now that I'm looking through, do you know what I'm referring to? I thought that in the report itself.
Right. Madam Chair, Bruce Gilbert for the record. I believe you're talking about the number of new enrollees as of December 5th. I don't know that it appears in this report. I don't believe that it does. Only because we will have we get updated numbers every week.
Right.
And so because it is a moving number and a moving target, we did not include it.
In the report where you had talked about the percent that had enrolled because they had seen enrollment, had been referred by enrollment assisters?
Yes, thank you. Bruce Gilbert for the record, Madam Chair. Again, that's another moving number. And actually, that was as of December 5th. So it is not in here only because it would not be accurate at the time that we provide it.
And that's kind of what I thought you were going to tell me, that since they're rolling numbers and they changed so much, that you wouldn't necessarily include some of those numbers as of, even though he would be understanding it as of the date that you wrote the report. But what I was impressed about was how well we were doing with new enrollees as of this date into it. You know, if one was to say, you know, compared with last time, it just shows what an excellent job we're doing. And I know some of that's and now fees are getting greater, the penalties, and I just thought it would show also that as an entity, we're functioning so much better with our outreach, our what you focused on when you were talking about federally the 15%, how, because we do work really hard on our advertising, our PR, our social media, our events, etc., that a lot of what we're doing and the way we are spending our money is reaching the population, target population, and here we are, third year, never more effective, more efficient. And I was hoping with numbers, even though I know they're rolling and they only are accurate for this point in time, and it would be reflected when we give our next report, hopefully. But
Madam Chair, there's an issue with your microphone. Would you be able to get another microphone?
did you miss most of that?
We did, unfortunately.
So So the gist of it was that even though any numbers would reflect where we are in this impressive numbers than we've ever have as to where we are at this point of time in our enrollment, do you feel that reflects the marked increase efficiency and the Can you still hear me?
We did have an issue for a moment.
Have you been able to get?
I do. Bruce Gilbert for the record. Yes, Madam Chair, I do understand what you're saying. And if it's the sense of the board, I would be more than happy, probably after the section on enrollment events on page 4 and before discussing navigators, enrollment assisters, and certified application counselors, to put in information with regard to open enrollment numbers that are currently available.
Yes, but even as important, how markedly improved they are. How much better they are over previous years. So it's not just the absolute number, but the number itself reflects that they are so much better at this time.
Thank you, Madam Chair. I do. Bruce Gilbert for the record. The one thing that we have to be careful of, though, is that last year and this year is very different. The reason being there was no passive re-enrollment last year. And because there was an active re-enrollment fairly early on in the process, we had over 40,000 people enroll. So it's a very different process. And there was at least one story in the media that said people are slow to warm to what we were doing in terms of the open enrollment this year. But the truth is, because there is a passive auto re-enrollment, you're looking at apples and kumquats. They're very different things. A much better understanding of truly where we are will occur when we get to the end of December, and the auto re-enrollments have gone onto the books, and we're able to take that snapshot and compare it to the prior year. Because right now, I mean, if you talked about simply new enrollments, there were 40,000 of them last year. They weren't truly new enrollments, but that's what they showed up as. And so I don't want to get into an apples and oranges comparison.
I understand completely. So we'll probably then need to just wait, and I understand what you're saying, until the next report that will hopefully reflect everything.
Thank you, Madam Chair. I think that would be a better course.
And I do like the way that you focused on the navigator and the, let me say, the strong broker alliance that we are now doing. So I would imagine that he can understand then that this has allowed our consumer that increased opportunity for education and knowledge about the plans and a better guidance to the proper plan to purchase, so that we don't fall into the trap, our consumers, of buying the cheapest plan, which is not the best plan. I thought it was a thorough and excellent report. Any other comments? And we have a motion to accept the report.
Madam Chair, it's Valerie Clark for the record. I'll make a motion to accept the report to forward on.
Is there a second?
Levon Lewis, I second the motion.
Everyone that's in favor of the report? Aye.
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 Is there any opposition? Thank you, Mr. Gilbert. The motion is passed. I would like to, at this time, ask our marketing team to do their marketing and open enrollment update. I'm sorry, who would be giving that report?
That'll be Ms. Davis of my staff.
Thank you.
Janelle Davis, for the record, Communications Officer. As Bruce alluded to, the exchange has made significant strides to reduce Nevada's uninsured population, and we have been working diligently to get our message to consumers. Our co-branding efforts with the broker and agent community have proven to be effective. 15,000 of those enrolled so far have used an enrollment assister, and that's the 65% that we mentioned. Our enrollment events for consumers to receive in-person assistance have been an ongoing call to action message for all Nevadans shopping the marketplace. Our media and advertising campaign has continued to receive positive and interested press while also reaching our target audience. Advertising was more aggressive around the 15th of the month events, with an emphasis on our December 15th enrollment event held in Henderson and Reno, which was also the deadline to enroll for coverage, and that has changed for today. The exchange has issued press releases before every sign-up Saturday event and large-scale enrollment events. We continue to participate in outreach events throughout the state and anticipate an increase in enrollees in January after re-enrollment. Our website was updated to reflect this open enrollment with an emphasis on our in-person assistance tool by zip code and monthly broker schedule for extended office hours. I will review our messaging strategy, and Melissa Dietz, media planner and buyer, will go over the media detail. Andres Ramirez and Yvonne Myers will review our broker update and outreach efforts. So for the PowerPoint presentation, there's a marketing update. On the first slide, we address our messaging strategy evolution. In the beginning or in the past, our message was more focused on we all have to have health insurance. It is now more tailored to be affordable and focused on a target audience. The evolution on this slide is that we adjusted accordingly to be event specific. So you can see the banners, and then on the bottom, the postcard mailers that we designed specifically for our events, as well as outdoor banners. On the next slide, we implemented a PSA style video to advertise enrollment through Nevada HealthLink that Governor Sandoval filmed for us. It turned out so well and was very successful that we did a quick turnaround to add it into all of our media outlets. And that would be TV, radio, online, social media, and YouTube. We also designed another PSA-style advertisement to discuss and warn Nevada consumers about how shopping on the internet can be scary, to not trust other websites. There are other websites out there that are kind of misguided and misrepresenting for Nevada HealthLink. And so here's a picture of Andres Ramirez doing a PSA for us. And also, I filmed one today, so you'll start hearing that, and everything will be infiltrated through all of our media outlets. On the next slide, we just wanted to do a breakout for you. These are all of the same messages and using the same message strategy in just different mediums. And so we have that broken out for you there. I'd like to turn it over to Melissa Dietz. She's our media planner and buyer from Penna Powers, who will continue up on the rest of the presentation.
Thank you. For the record, Melissa Dietz with Penna Powers. This next slide, it looks similar to what we had last month, where we're just showing you an example of the impressions we're expecting to have delivered via TV, radio, outdoor, and print through December 15th. You'll see we have about 45 million impressions in Las Vegas and just over 10 million impressions in Reno. And then on the side of that, you'll just see we dropped in some logos of some local of the television radio stations that we're working with, and then also some key programming that we thought would be interesting, such as the NFL and Empire and Rosewood and local news. So overall, we had estimated, we had planned a little bit differently, and then as we said, we would try to be nimble as this campaign went along. So we were able to add a little bit more budget to our schedule as we went along. So we added another 6.2 million impressions. The next 2 pages, we were just asked to make sure that we were covering the rural communities well. We knew we had Las Vegas and Reno covered, but we wanted to make sure that we had those rural areas covered. So this is a little bit of an eye chart, but you can take a look at it, at all those key zip codes that we were concerned with, and you can see that we did have most of them covered with newspaper, radio, and TV. So moving on, stop me at any point if you have questions. We've kind of been over this, so you guys may just all look at it and go, I've already got it. So with the digital media, the next page, this is just a list of the digital media vehicles that we've used. We delivered over 4.1 million impressions from November 1st through November 30th. We had over 6,240 key actions, which is where they go to the website and either look up a broker, use the subsidy calculator, or the contact page, or click all the way through to the .gov site. So again, being nimble, partway through this campaign, we did switch some of our spots or some of our ads from Bing and Yahoo to Google, because we found it was more efficient, it was less costly, and we were getting better reaction to it. So there is a little bit for you to go over. The next 2 slides, we were asked last month what the best performing digital ads we had were running. So we just wanted to include that. So you can see here our top 3 English ads, and then on the next page, you can see what our top 3 Hispanic ads were. And then the following page is, again, just a little bit more of the digital media, but it's just drilled down with more analytics and more specific information on the different media vendors that we were working with and how each of the creative performed with those vendors. And then we have social media.
And I will be talking about social media. This is Janelle Davis for the record. Basically, in November, we had a total of 34,547 engagements that took place, and that just means people who actually took action. And on the right, there's some examples of what our posts look like. And so when you click on here, it's driving people to our website, which discusses open enrollment. The social website traffic accounted for 30.7%, or 16,827 referrals of all acquired website traffic in November, which is an increase of 1,953%. And the main message here is there hasn't been any negative messages like in years past. And it's important to note that most all people are using social media. And so our messaging is driving folks here and then to our website, which is driving up awareness about events. And so it's working.
Melissa Dietz again for the record. I'm just going to touch a little bit on the PR and media relations. What we love about this whole marketing effort is that both the media, the paid media and the earned media, just seem to be constantly leveraging each other. So if we paid for something with media, we were able to go in and leverage the PR side. And then on the PR side, whatever they were able to do independently just somehow led right back into what our paid messages were. So we're really happy with just how these 2 departments are just married together. So at this point, the earned media, because it's been such a huge success, we're just going to keep on with those efforts. We have a number of things that we did in November, including an interview with Bruce Gilbert on KRNB. He had a guest column in Las Vegas Sun. We've had numerous interviews on the radio stations on their community programs that are generally a little bit longer form, so it gives you more opportunity to talk about what our overall efforts are with the health exchange. We've also had both English and Spanish language efforts. Overall, we're happy at this point. We see almost $6.8 million in earned PR coverage. So, and in the back of the document, you'll see we gave greater detail in an appendix with more media evaluation and specific channels that we worked with. So, and then the pages following right behind this, again, just a very quick summary of efforts that we did in November to get out there with our media outlets.
This is Janelle, for the record. I'd like to introduce Andres Ramirez and Yvonne Myers if they'd like to do the broker update and then the outreach update portion.
Yvonne Myers for the record. Our broker update for our co-brand and marketing, we currently have 684 brokers on our listserv. And this list is compiled of brokers in the area who can be found on our lookup tool on the Nevada HealthLink website. We also have 254 brokers that have opted in to do these co-branding events with us, whether they were midweek pop-up events, sign-up Saturdays, the middle of the month events that we had both in Henderson and Reno on December 15th and coming up on January 15th. Brokers were notified also to come pick up marketing materials that we made for them to display in their offices. And we had 33 brokers pick up materials in Carson City, and 142 brokers picked up materials from Henderson.
Good afternoon, Andres Ramirez for the record. We're going to do a quick outreach report. We continue to attend more and more events throughout this process, especially as open enrollment has begun. Up to date, as you may have seen in your fiscal report, we have participated in over 30 events that we specifically represented Nevada HealthLink. And those events had over 30,000 people in attendance combined. And we've been able to have now around 5,000 one-on-one conversations with consumers to engage them in the process. So that's been pretty significant, and we're proud of that, but obviously we still have a lot more to go. In addition to some of these outreach events we've done for consumers, Health and Human Services contacted the exchange and asked if we would help them put together a roundtable with Secretary Sally Jewell from the Department of Interior and Dr. Mary Wakefield, who's the Assistant Secretary of HHS. So we did that on a Friday, December 4th, and we were able to get some stakeholders from Las Vegas to sit down and have a conversation about what we can do to increase messaging and partnerships. So although that event did not get a lot of media attention, we were able to get some good conversations from that event, and HHS agreed to put us in partnership with some of their national partners so that we can increase collaborations here in the state. So that was good. Our most recent event was Tuesday, December 15th. We had it at the Henderson Convention Center here in Southern Nevada and at the Ramirez Group office in Northern Nevada. It was just a 4-hour event in the early evening from 4 to 8 p.m. And that worked out really, really well. In terms of actual consumers that we were able to assign to a broker to pursue a QHP application, we registered on our system 87 different consumers that were assigned to a broker during that period of 4 hours. So that was pretty cool. And now we are just focusing on additional enrollment events. So January 15th will be the next deadline, and January 30th, obviously, our closeout event. Janet Quintero is not able to join us today at this meeting. She's actually currently meeting with the entire building staff of the Clark County Government Center to ensure that we go over final logistics for that event and that we can finalize that. In Reno, we are still working on some locations to confirm, but we have a couple of community centers that are available that we are looking to lock down.
Would that conclude your report? An excellent report, excellent performance. Is there any questions from anyone up north? Comments appreciated. Any from down south?
Madam,
I want to know how
Madam
you
Chair.
got Brian Sandoval. Yes.
Sorry, just Jose here. I was just going to make some quick comments that today I came down here up here for my orientation, and on the way here and just now during lunch when I was driving around, I heard the radio spot several times, so it's working.
That's the best kind of comments of all. We like to hear that. And on Brian Sandoval, we're very fortunate in our state to have had a Republican governor stand up and support the expanded Medicaid and the Affordable Care Act, and to be as far along in this process as we are to having our uninsured Nevadans have access to health care. And it goes one step further that he would actually stand up and also do a video for us. And so I'm not sure who or how you got that accomplished, but just kudos to whoever did that. And then my other question is, does he speak Spanish? Was it also done in a Spanish version?
This is Janelle Davis for the record. The video was not recorded in Spanish, but we were able to get it on all media outlets, but we could take that into consideration.
And then I just want to say I was very impressed with all the numbers. Particularly, I wanted to ask Mr. Ramirez a question because this is now his third time around, and he has seen us go through a lot of changes, and wondering what your personal opinion is on how you compare how we're now functioning, and if you feel comfortable to give us any insights as to any downside. I'm seeing a lot of upside. This report was really wonderful. We've really changed a lot in the way we've done things in 3 years, and you've been through the 3 years. Would there be anything else you would do differently?
Andres Ramirez for the record. So, Madam Chair, each year has presented its own set of challenges and opportunities. So it's been a great learning process throughout the entire term. I would say that we're in a different place given that the first 2 years enrolled so many people, whether they were Medicaid or Medicare or QHP. So, by successfully reducing the amount of uninsured people in Nevada, this becomes a much harder process to do to find those that haven't enrolled. So the strategies and the practices that we take to try and reach that population, we have to continuously adapt and be innovative to reach them. I think the plan that we've put in place, given what we knew when we started this plan, is a very effective plan. As Ms. Dietz said earlier, being part of the Penna Power teams, we're very nimble, so we adjust as needed if we see things aren't working. I think one of the things that we have noticed is that last year when we did the stores, it was very easy for us to have a visual and a constant sense for how many consumers we were reaching and driving to a location for our broker partners and navigator partners. And now that we're driving consumers directly to brokers' offices, it's less visual for us to see how much of an impact we're doing in that process. Obviously, as Mr. Gilbert reported, we're still having a very successful rate of enrollment, so something's going right. But it is harder for us to monitor the impact of our efforts because it's dispersed through a wider process. I also think for some of our broker partners, it sometimes may be harder to understand how much we're helping them because they're not all clustered in one location to see the fruits of all our labor. So I'm not saying one's better than the other. Again, I think the results and the enrollment numbers will speak for themselves. But definitely we're seeing some different challenges in terms of trying to find those people who still are uninsured that we haven't been able to reach in the first 2 years, to find them through new efforts and get them to participate in the process.
Thank you very much. What is your feeling about the approximate 16,000 number that have been enrolled so far with the use of enrollment assisters?
I think that's a great number. I would say that exceeds the total number of consumers that were enrolled by an assister in year one. So the fact that that's the number that we are after 1 month, I think it's an impressive number. But we've also seen, whether it was year one or year two, that the bulk of enrollments happen in the last half of the open enrollment period, and we're just at the halfway point. So I'm eager and excited to see what happens in the remaining 6 weeks. But I'm also cautious because, as was noted, I think what we're seeing is an increase of enrollment all around the country. And while we're relying on the healthcare.gov portal, that the more bandwidth the more impact that keeps being put on there by consumers, that we may see some more hiccups as people are waiting for the last 6 weeks to enroll.
Thank you very much. And I agree, I was very impressed with that number. And also with the 30 events you've had. And when you noted that the last event was just 4 hours, I would say that was a very good length of time. So were there any other questions on the report? No other questions on that? Then we will proceed to the next item, the call center update.
Thank you. This is Heather Korbulik, Chief Operations Officer, for the record. Let's go over a little bit of the numbers from the last 3 months. The table 1 is showing the statistics of the calls handled. We received a total of 2,011 calls for the month of November, which of course is an increase over the preceding months. But our abandoned call rate has remained very low. In table 2, you can see that we are continuing to have about a 3-minute call time, and our abandoned times, our times remain about 3 minutes, and our hold and abandoned times experience a slight increase because of the call volume, but are really reasonably low. Table 3, you can see the top 5 of the issues that callers are contacting our call center about. Those include 2014 issues, which are decreasing, and increasing a little bit in November, decreasing 1095A questions, and then additionally a big uptick, which we would expect and hope for, about our 2016 enrollment. Many of our calls are still continuing to be forwarded to healthcare.gov and to Medicaid Nevada Checkup. About 424 of the consumers that called us in the month of November called specifically about our open enrollment in 2016 enrollment. And our challenges really are decreasing in terms of our 1095A questions and concerns. And so things are going well and steady in the call center.
Thank you very much for that. Were there any comments on the call center report from the north or south? Agenda item number 8, discussion and possible action regarding dates, times, agenda items for future meetings. Does anyone in the north have any suggestions for future agenda items? In the
Madam
south?
Chair, it's Valerie Clark
I'm so
for the
sorry.
record. That's all right. Valerie Clark for the record. Did we discuss the UHC letter today?
For the record, Bruce Gilbert, we have not discussed it in the course of the meeting today.
If we don't discuss that today, we should discuss it in the future, and probably follow up on the ramifications of it going forward.
We'll make sure that it's on the agenda for the next meeting.
Thank you, Valerie. That was actually beat me to my suggestion. I would like to have that issue discussed at the next one, not specifically that letter and that company, but a broader discussion of the topic that was brought up in that letter, which is that particular insurance company or any other companies that are no longer paying commissions at certain times, just to update every board member on the extent of that topic. I think some people might not be aware that it's a little more extensive than what's just in that letter. and it would be good to inform everyone. So I'd like that on the agenda. Was there anyone else that wanted to add another agenda item? I'm sorry.
This is Betsy, and I'm not really a voting member, but I think it would be important to have a summary of the comments you make on the proposed reg. I know you kind of summarized them in your report, but that could have a big impact on go forward things. So.
Thank you, Ms. Ayala, and I will make those available.
And I have to apologize because I don't quite understand what she means by proposed regs, because I'm not sure if that actually gets into the next thing I was going to say.
Madam Chair, Bruce Gilbert for the record. I believe that she was talking specifically about our response to the a proposed rule by CMS that discussed, among other things, network adequacy and the fee that would be attributable to a state-based exchange that remained on the federal platform, the requirement of having navigators available post-enrollment, and some other things. Is that correct, Ms. Ayala? Yes, sir. Yes.
Good, because again, that's what I was going to ask about, but wanted to make sure that it was expanded to include all those things. But also, and I'm not sure if this was going to, when you addressed it, whether you were going to include this, but I know that you're constantly thinking about all the different options, and I certainly don't want you to bring anything to us until you have thoroughly researched it and had an opportunity to look at the different options and feel which are truly viable, both from logistics and financial point of view. But I was really hoping that at our next meeting, we could see your top one or two alternatives for us as we move forward to the federal hub.
Thank you, Madam Chair. Bruce Gilbert for the record. As you know, our friends in Oregon are releasing an RFP specifically with respect to determining which vendors that currently provide existing technology to operational state exchanges might be interested in expanding their client base. My understanding is also that the terms of that RFP would indicate that there is the potential for additional states to take advantage of whatever pricing is extended in that RFP. They will not have those results available probably until sometime in February. So before taking any action and presenting anything to the board, I would like to get an understanding of those vendors that have responded to them. I mean, I have shared with the board, and I will share freely the fact that I have spoken with multiple vendors, each of whom, surprisingly, has indicated an interest in assisting us in securing an affordable alternative to healthcare.gov, and not simply an affordable alternative, but a system which would provide ad hoc state-specific reporting, and that would, I think, make it easier for us to service our consumers. You know, one of the constraints, and I'll be the first person to say, being on healthcare.gov for the past year and for this year has been a wonderful thing. It's gotten us away from the tragedy that was Xerox and has put us in a position where we can thoughtfully take a look at options that may be available. I absolutely believe that the board in May of 2014, when they made a determination not to look for another platform, but rather to work with the federal existing platform, that was the right decision at that time. Times have changed, and I will be more than happy to provide additional information to the board. It may not be possible next month, but I will certainly make that available as that information is gathered.
Thank you so much, Mr. Gilbert. Having I think those are going to be two great agenda items to discuss in future meetings. And I did forget to thank Yvonne for coming with those numbers this time, and the actual number of brokers that are working with us now. And I'm excited to see how that has increased significantly, almost 30%. And also to see how many of them have picked up materials. That was really exciting to hear that 142 came and got materials. That is amazing. So thank you for follow up on that. So having said that, and I would like to now ask if there are any other public comments in the north.
Valerie Clark for the record. One more item, I'm sorry, for a future agenda would be, I think it would be good to maybe do a summary at sometime in the first quarter of the changes to the ACA that we've been through in the last few months and may go through in the next few months. Most importantly, I think, is the trending up of the maximum out of pocket that HHS is proposing. I think it's an important thing for the board to be aware of. As well as possibly the repeal of the Cadillac tax, as well as the changes in the group size between small and medium, or small and large group. I think those are important items for the board to be aware of as they do affect plan design and plan availability.
Thank you, Valerie. Mr. Gilbert, thank you so much for adding that as a third item for next. And I think that that information, Valerie, is just invaluable because as much as we all try to stay up with all the changes, we aren't able to do it. And I think, Bruce, you are so much more aware of that, and your staff can give us a fairly complete update on that. Thank you. So, any other agenda items? Okay. So, was there any public comment from the South? That being the case,
Excuse
I
me.
want to thank
Madam Chair,
Yes.
Madam Chair, I
Yes.
believe Ms. Nielsen has something to say.
I just wanted
definitely.
to
Please, Ms. Nielsen.
mention that you may want to circle back to the item 3 on the agenda, the approval of the minutes from the November 12th. I don't believe that.
Oh, yes, thank you so
got
much.
approved.
I actually thought we did do that.
I thought we did.
We did.
Oh, we did.
Yvonne was the first on that, and we did approve it. Yes. Yvonne was the first on the motion, and I believe someone up there was the second, and everyone said aye.
Correct.
But I thank you because I know we almost were going to pass it by. So I think that having been said, I want to thank the staff for their excellent work and Mr. Gilbert for your excellent report on our progress to the governor. And I look forward to your report, your executive report next time, and to all the exciting things that are going to be unfolding about how we will yet morph ourselves for the future. Thank you, everyone. Meeting adjourned.